Assalamu alaikum everyone. Today we're gonna talk about the convergence, accommodation, and light reflexes. First of all, I'm going to initiate our lesson by talking about the convergence and accommodation. One of the main functions of the convergence and accommodation is adjusting the eyeball according to the movement of the person or things toward you. Okay, when you look at something or someone, when someone or something is moving toward you, your eyeball adjusts for focusing on this item or body. Okay, today we shall talk about that. Please look at that. That's the direction of the person or something, and there is the pathways that relates to adjusting the eyeball and iris and length. Okay, and one of the main functions of the retina in this position is providing information about this movement of the person or something to the hemispheres. First, fibers terminate at the lateral geniculate body. After that, lateral geniculate body directs this information to the hemisphere, occipital hemisphere, that's responsible for visual function. Okay. After analyzing this information, the hemispheres direct this information to the protectal area. Please memorize that protectal area is located in superior colliculus. Okay. The next stage is direction of the information to the nucleus of Purlia. One of the main functions of the nucleus Purlia is directing the information to the accessory nucleus, adding a vespal nucleus in the green color, and to the oculomotor neuron that's responsible for movement of the medial rectus muscles. Okay. After getting this information from the nucleus of Purlia, that two neurons try to accomplish its function by contracting the medial rectus muscles and sending some information to the ciliary ganglion by adding a vespal nucleus. After reaching there, the parasympathetic fibers directed to the two things. First one is iris, second one is ciliary muscles. One of the main functions of iris at that moment is decreasing the size of the pupil. One of the main reasons for that is directing the shape of the thing or someone to the retina properly. The next thing is about the contraction of the ciliary muscles. You know, the ciliary muscles have two functions: increasing the shape, changing the shape of the lens according to the position of the object that we are focusing on it. Okay, and when you look at something far away from us, that's relaxation of the ciliary muscle occur. Due to this, at that moment, some kind of fibers that sustain the lens become this shape. Okay, become this shape, and they pull the lens, and it can cause the shape of this kind of shape of the lens. Okay, and when we look at something that's located near us, the contraction of the ciliary muscle occur, and the shape of the lens become spherical, more spherical. One of the main reasons for that is directing the shape of the objects to the retina properly. Okay, and there is some kind of overview I will do for you. Okay, and when we are looking at something that's coming to us, and retina send information to the lateral geniculate body and then to the hemispheres that's located in the occipital lobe. Okay, after analyzing the information, it sends the information to the protectal area that's located in the superior colliculus, and the next stage is nucleus of Purlia. Nucleus of Purlia discharge and sends the information to the oculomotor neuron that's responsible for contraction of the muscle, medial rectus muscles, and adenovaspal nucleus that's responsible for parasympathetic innervation of the iris and ciliary muscles. And that's all. That's convergence and accommodation. Okay. And the next illustration is for you is pupillary light reflex. There is difference between convergence and accommodation and pupillary light reflex. In the hospitals and other places, neurosurgeons, neuropathologists, and reanimatologists use some kind of flashes to check the light reflex. According to the changing of the size of the pupilla, they make a correct diagnosis, or they think about some kind of pathological condition in the patient. Okay, look at that. When the light is directed to the eye, that is a retina accepts the impulses from outside, and retina provide about the light information to the protectal nucleus, not to the lateral geniculate body. Don't forget that. Directly to the protectal nucleus. After reaching there, the impulses divided into two sides. First one is direct to the ipsilateral nucleus of the adenovaspal, and the next one is direct to contralateral adenovaspal nucleus. According to this, directing the lighting to the 1A can cause the contraction of the both pupils, both iris. Okay, the changing of the size of the pupilla can occur in both eyes. Okay, due to this bilateral innervation. And there's some kind of clinical signs that if there is some kind of damage in the optic nerves, when you direct the light to the 1A, the information couldn't reach there, and there is no any change in both pupils. Okay, in this situation, if you direct the light to the healthy eye, the impulses go there and innervate both adenovaspal nucleus, and contraction of both pupils occur. Okay, that's the main clinical consideration. Okay, and look at that. If some kind of lesion located there, when you direct the light to this eye, the impulses reach there, and contraction cause in contralateral eye, that's healthy eye. And when you direct the impulses there, also impulses reach there and innervate both adenovaspal nucleus, but the impulses couldn't reach the damaged eye. Okay, it may be the lesion that relates to oculomotor neurons. These parasympathetic fibers accompanied by the oculomotor neuron. Okay, and there is small illustration for you. That's the structure of the iris, and there is the dilator muscle that's innervated by the sympathetic nervous system. And when you stimulate the sympathetic nervous system, you can find out that increasing the size of the pupil. Okay, and that's the sphincter papillary muscle. Its main function is constricting the pupil. Okay, when the patient has some kind of increasing the activity of the parasympathetic nervous system, you can find out that there is a contraction of the iris, the contraction of the pupillary side. Okay. All of the main and beneficial information for you is all. Thanks for listening and watching. If you have any complaints or some kind of suggestions and offers for us, we're always ready to read in the comment part of our YouTube channel. Thanks for listening and watching. Take care of yourself.